I need another piece.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way things are. Tall tales will take you very far. Don't scoff when they say it's the end. In this life we know you can't pretend. The days pass by, baby set in stone. But it's not too late now for you to change your tone. Don't speak. Don't speak. Open your soul. Don't harden your heart. Don't speak. Don't speak. Open your soul. Don't harden your heart.
Oh. Hey everyone, good morning. This is Marianne from the New York City Organization of Public Service Retirees. And I have two great guests with me, Claudia and Julie from St. Louis, Missouri. They represent a doctor's office there, Arthritis STL. I believe that's your name, correct?
Arthritis Center STL.
STL. And they're here to explain to everyone today about how healthcare insurance companies are manipulating profits over people and how they on their side actually experience it very different from what we see on our side, or at least what's being told to us. So we want to start a series of these conversations because we think that the messaging is getting lost. So we're live streaming this today in Facebook, LinkedIn, Twitter, YouTube, Instagram, and I think you guys are also
TikTok.
going to TikTok. Yay.
Right.
So let's get into this. I'm a New York City retiree. I worked in New York City Fire Department. I currently represent 250,000 retired workers and their families. We've been suing the city of New York for almost 4 years to stop them from forcing us into an Aetna Medicare Advantage plan. When they went to our unions, and remind you, when you retire, you are no longer in a union. So you take your pension check, your health benefits that you were promised, you sail into the sunset, and everything's supposed to be wonderful until several years later. And I'll tell you, my oldest retiree was 103 years old and just passed away.
Wow.
He was a New York City firefighter. This was a shock because we learned about this change in the newspaper. Not even our former unions told us. So when we start hearing facts like Medicare Advantage is wonderful, over 50% of Americans choose Medicare Advantage, we're like, no. We're not choosing this. We're being forced into it. And there's something called auto enrollment into Medicare Advantage.
Awful.
So what these insurance companies are doing is going to management and telling them, hey, listen, we can offer you a Medicare Advantage plan for free, and it's enhanced and it's better than traditional Medicare, and that'll save you money. And then in turn, they go to the unions and they say, hey, you put those retirees that you used to represent into Medicare Advantage, we'll give you a raise, or we'll give you that money. For us, they told the unions that they would give them $600 million for doing it.
$600 million to sell out the retirees who worked their entire lives thinking they were going to have everything covered when they retired.
Yes. That's what they said.
Yeah. Listen, if something is going to have a price tag of a $600 million buyout to leadership, you're getting $2 million worth of, whatever it is, times it times three as to how you're screwing the people.
Now, tell everyone here the difference. So we know, to me, Medicare is a federal public health benefit. It was passed in 1965 by Lyndon Johnson, and it was to provide people with equal access to doctors and hospitals around America. And actually, today is MLK Day. MLK actually helped with that because back in the day, there were there was segregation, there was discrimination. You had Black waiting rooms, white waiting rooms. You had hospitals that wouldn't take people of color. Medicare was actually implemented to stop all of that. And if doctors and hospitals wanted federal dollars for treating patients, they had to do away with those discriminatory practices. Tell us what you see, though, when a patient comes into you, let's say with the same need, a same rheumatology need, the same injection needs, the same treatment needs. One has Medicare and one has Medicare Advantage.
So first of all, as a rheumatology office, we have a target on our backs because of the price of the drugs we prescribe. And it only affects about 2% of the people, but those 2% really drive the spend. However, if 2 patients walk in the door, one has traditional Medicare with a supplement and one has Medicare Disadvantage. That's what we call it, because it's not Medicare Advantage. It's Medicare Disadvantage.
Right.
If they both walk in and they both need to have an office visit, a joint injection, and an infusion, the Medicare Disadvantage patient better come to the table with $3,000, because unless and until they fulfill their out of pocket, they're not getting anything. On the other side, if they have traditional Medicare and a supplemental plan, they're covered. There's no prior authorizations on the Medicare side. There's all sorts of hoops and prior authorizations. Prior authorizations are a permission slip to make Aetna or United Health Cartel or Cigna, whoever is sponsoring their Disadvantage plan, their money. Okay. They want it to be one size fits all, and that's the profits of the insurance companies. You become the secondary. If you have Medicare Advantage, you are the secondary. Whereas if you have traditional Medicare, you have a traditional secondary that pays as a secondary. That's kind of the biggest thing I see. How do you see it?
So I see unions getting taken advantage of a lot in this coming year. There's their medication benefit managers is what they call themselves. And they have been a lot of our recent TikToks, as Julie and I calling them, being like, we want to unenroll this patient. They're like, no, patient has to call us. Girl, I worked in the car warranty industry, and they're using some of the same tactics. The reason they want the patient to call is because then they can call the patient as many times as they want without it being considered harassment, because when you listen to the recorded line, you're giving them authorization. They also make you functionally uninsured. So they'll scare you and be like, if you're not signed up for this, you're going to be responsible for 30% of the coinsurance for your medication. Do you know how much that is? And then they scare the patient because it's like $3,000. And they're like, well, I can't afford $3,000 a month.
But they literally make up lies to fit their narrative. Okay. The reality is, if you ask the doctor's offices and the people doing the work on the ground, nobody wants Medicare Disadvantage. It's a nightmare administratively. It screws the patients unless they're wealthy and they're not sick. If you're wealthy and you're not sick, maybe Medicare Advantage might be an advantage to you. But anybody that's wealthy knows better. Okay.
Well, at least needs to have a doctor. We have retirees that we've been helping fight in the New York City transit system that were forced into Medicare Advantage by Aetna in January of 2024. And these are the calls that we're getting. There's the doctors. So one is in Arizona. Their doctor and hospital are affiliated with Mayo Clinic. Mayo Clinic doesn't accept Medicare Advantage.
Of course not.
Now they need a new cancer doctor and a new orthopedist. They were going for weekly knee injections. They can't do that anymore. So they had to find another doctor that would take their plan within their area. One of your TikToks, Claudia, was talking about a desert ghost networks. And that's exactly what we're seeing with Aetna in some of these more rural areas. And sometimes they're not even that rural. So he's in his 70s. He has to drive an hour to get to the nearest doctor that can that can treat him for either one of these illnesses. Then I have another lady who lives in Texas, similar situation, and she also had the doctor wanted to give her an implanted defibrillator. She developed a cardiac issue, and her heart wasn't beating correctly, and they wanted to do this implant. The Aetna Medicare Advantage told the doctor, no, she's going to need to wear this life-saving vest for 90 days, then do an echocardiogram, and then we'll reevaluate and determine if she qualifies for that. Well, in the middle
of all this unnecessary testing and charge the insurance plan and make the patient responsible for all these tests, and then we'll try it again.
And so in the middle of all of this, she's wearing a battery operated chargeable vest, and Hurricane Beryl happened to hit Texas, and she lost her power for almost a week, just over a week. So she now had no way to charge this vest. She called me freaking out. She was sitting in her car with her phone plugged in and saying, I don't know what to do. This thing is beeping. And I said, it's beeping because the battery is low. You've got to charge your vest. I told her, go to the nearest firehouse. Went to the firehouse. Nobody was there. So it's like, this is not patient care. And then last week we see on TikTok a doctor, I think in Austin, Texas, freaked out because United Healthcare only wanted to talk to her about something that she had said.
I think for surgery.
I think her name was Elizabeth, right? Dr. Elizabeth. I think her last name was Potter, even like Wendell Potter, wasn't it?
Oh, I love Wendell.
I love Wendell too.
Ugh.
And she literally came out of surgery and left the patient with another surgeon to take the phone call from United Healthcare, which then they weren't on the phone. This is a frustrating system of healthcare. So to answer some of the union questions, we had a guy that called me last week and said, hey, listen, management is telling the unions that the reimbursement is the same. And one, they don't know what that means. They're thinking that it affects the employee or the retiree. It's not. It actually affects you guys, the doctor, hospital, medical provider. Even though Aetna is telling them the reimbursement's the same, this is an employer group waiver plan. It's through the city of New York. It's through the state of New York. Tell me from the provider side, since you're the doctor, how does that affect you?
Well, tell them about whenever you agreed to the reimbursement, and then in the small writing, they tried to require us to go to the specialty.
Right. Well, I mean, there's a bunch of different levers that the insurance companies use to railroad you guys and then railroad us into it. Okay. So for starters, it is a common practice for physicians to get less than Medicare allowable for their normal, what we call E&M codes, which are evaluation and management codes. All right. In the Medicare Advantage space, every year we get a reduction in pay for the last 6 years. On January 1st, we got another 3% reduction in pay, all at a time when my expenses are huge. I can make a fair wage if I have decent contracts on the commercial side, but on the Medicare Disadvantage, when you put in the referrals that are required and the one size fits all and the administrative burdens that I have to jump through, it costs over and over and over again. You will see as a national trend that more physicians, more hospital systems, more places like Mayo Clinic are saying no more Medicare Advantage. Why do you think that is if it's so freaking great? Because it isn't. All right. That's why. People have had it. Physicians are walking out the door and saying, you know what? I don't need this aggravation. I don't accept Essence Medicare Disadvantage. You know why? Because they're terrible. They're terrible to work with. I don't accept Cigna.
Right.
Commercial or Medicare Disadvantage. Why? Because they're terrible to my office. They're terrible to the physicians doing the work. And when people are terrible, all you can do is be like, you know what? I'm going to take the path of least resistance. I'm out. So you have these narrow networks, and it's not in the retirees' best interest to have a narrow network. They need more choices than ever. They would have all those choices if they had traditional Medicare and a supplemental plan, but their choices are taken away because Aetna's doing a pay-to-play with the leadership. Yep. In Missouri, which is where we are, there are 400 Medicare Disadvantage plans. If it was so great, why would I have 400 people climbing and clawing at all the people that turn 65? It's a for-profit jam job.
Well, and let's keep in mind, it's a private company that you're giving the permission to make a choice on whether or not something's going to be covered. So a lot of times we talk to people offshore that have free healthcare. So when they're denying a claim, they can't comprehend what they're denying. They're like, oh, this person, what do you mean they wouldn't get treatment? It's like not even fathomable for them.
Yeah. I mean, there's so many administrative hoops for a physician's office to jump through. It is not apples to apples when you're talking about Medicare Disadvantage and Medicare traditional. We do not get paid fairly for Medicare for Medicare Disadvantage. Actually, we were talking about an example that maybe people can understand better is if you had a grocery benefit manager, like you have a Medicare Disadvantage manager. I don't know there, but we have Schnucks, Deerberg's, Aldi, Whole Foods. Okay. Those are some grocery stores. Obviously, Whole Foods is the most expensive and Aldi is the cheapest. I prefer to shop at Aldi for everything except like Jif peanut butter or a couple of brand name things. But it would be like if Aetna came in and said, oh, guess what, Julie Bach, we are going to manage your grocery benefits. You can only shop at Whole Foods. Well, I don't want to pay $19 for a bar of soap. Well, you know what? We've negotiated the best price. That's what you have to do. They're removing choices from me, from you, and from the retirees and lining their own pockets with the fake savings. It's not fake
and actually
savings.
You guys have also are fighting not just the insurer, but because the insurers require, like in an MA plan, to use their own PBM, you're fighting the PBMs as well.
Yeah, so Aetna owns CVS Caremark. And so what they do is a lot of these plans, and particularly in some of the unions, they have all these clauses of saying, okay, well, if you mandate to CVS Caremark, let's just choose one. They forget to say, oh, by the way, we own it. Let's triple dip. Let's get all the premiums from the retirees. Let's also mandate all those prescriptions to our own specialty pharmacy that we own that makes billions of dollars off the backs of the working people and taxpayers. And you're going to all follow our therapy plans because we're so great at fraud and abuse. Nope, you're not. Listen,
Right.
If doctors could just go back to practicing medicine and treat each patient individually, we wouldn't let the handful of people that are doing the wrong things physician-wise have their fraud and abuse. The real fraud and abuse are the insurance companies. And the really, really fraud and abuse are the pharmacy benefit managers. And I'm looking straight at CVS Caremark, Optum, and Express Scripts. Those three are making bank off the backs of all of us.
Yeah, and that comes with your high cost of drugs.
Right. It's rheumatology patients are super complex. Most of my patients have at least 3 chronic diagnoses, but many have 10 to 15. So one size doesn't fit all. And so I've actually seen Medicare Disadvantage plans from Aetna come out and say they have to try and fail 6 different rheumatology drugs before we can put them on. Are you ready for this? The least expensive biologic. They want more expensive drugs times 6 that are more invasive to the patient than what my clinical team wants to put patients on.
And once you're stable on therapy and you are actually in remission, changing you off that drug just to see if like the biosimilar works is extremely dangerous. Like we're selling hope constantly to patients because coming in knowing you're going to get a diagnosis and your life's going to change, that takes a lot of courage. And then once you think you have a treatment plan, but then you're met by your insurance saying, you need to try some more ibuprofen, I think. And
yeah, or perhaps instead of getting an MRI, we'll have you do physical therapy
scan on your knee,
or is physical therapy for 6 weeks with your broken leg. No, let's skip the bullshit. Let's just go right into it and let the doctors make the clinical decisions.
The people that went to school, not the ones that were secretary and worked their way up to denier for hire.
And the thing is, we're a little bit unique because we appeal absolutely everything. Okay. A lot of physicians' offices don't have the tenacity, the bench strength, or the time to appeal everything. I have 24 support staff for one physician.
Well, and this puts a huge target on her back. We've had so many insurance companies, like in the wake of Dr. Bach passing away, it's like they're doing every problem they can to like infiltrate themselves and stop like the arthritis center. They're like, this is our option. We're going to tear this bitch down. I'm so sorry. We're going to tear this woman down. And it's honestly heartbreaking because like we have a network inadequacy. Without our office, we're in a very low income area. Our patients won't have care. Physicians in our area have actually said, if you're a patient of Dr. Bach's,
you're too complex.
We can't see you.
Right.
So it's putting these people out on the street and it's like low income, disabled, and hardworking people are just going to be SOL. And Julie and I are like, nope, not on our watch. But it's like we can only fight so much before, you know, I don't know.
Well, here's the other thing. Nationwide in the United States of America, there are 3,900 rheumatologists. One rheumatologist serves a population of about 200,000. $3,900. Like, the insurance company should be embracing me, saying, oh my God, look at this beautiful experience this woman and her team provide to our members, our patients. But no, what are they doing? They're sending me cease and desist letters. They're trying to, intimidate me. Well, guess what? This old girl's 60 years old, and I've already stood at the corner of hell and buried my husband. So we're going to just get this done, because I can speak up and I will speak up. Every one of us is a patient, and every one of us has been denied and delayed by our insurance company. So by God, what gives Aetna the right to come in there and switch up the game on the New York retirees? It's insane. It's insane. And they're trying to sneak it under the rug with the $600 million or whatever it is, payola. And
we'll slip in the Save RX, where you guys aren't going to get any specialty medicine, and your plan's going to be so much more affordable, because we're not going to cover any specialty meds. They're going to be not medically necessary.
Yeah. I mean, just
a few things. Tell us, that's really important. I've not heard of Save RX, and I've watched your TikToks. Tell me what that is.
So it's like the pharmacy benefit manager, and then they call themselves the medication benefit manager. And I've gotten on the phone with them, and their goal is to strictly just get you off the phone. They want to confuse you. Your employer signed you up for this. You have to use this in order for your, otherwise, otherwise you're going to be responsible for 30% of the entire cost of this drug.
Also not true.
No. What they do is they make you functionally uninsured to where you're eligible for the Patient Assistance Foundation money. Once you get that, or once you're approved, they raise the tier of your medication, and it siphons out the funds quicker than if you were to just use the copay assistance and pay $5 a month. Plus, they end up paying like $100 every month, because there's an administration fee to have the doctor's office fill out the paperwork.
Which we are not getting that. Save on SP is getting that. Here's the thing. A copay accumulator program is a middleman that sits inside of a middleman. It's like, so you have CVS Caremark, and then there's another middleman called Save on SP. Save on SP,
or Save on, or Save RX,
Save RX,
or
Save on. I mean, there's so many. It's like whack-a-mole. They change their name a little bit.
Just look at the back of your card. If you see Express Scripts, Accredo, and then a lot of times they'll give you a second card.
So you have this middleman sitting in between your insurance company, Aetna, and your pharmacy benefit manager, CVS Caremark. Now you have Save on SP. What they do is they take the manufacturer's copay assistance card and they extract it, use it all up in 3 months, and then the patient can't get any medicine. But in the meantime, they're filling them with lies about, oh, well, if you don't do this, you're going to pay $3,000 or $7,000 a month. All not true. One of my patients and myself have actually given depositions for J&J, the makers of Symphony Aria and a whole lot of rheumatology drugs, because they filed a lawsuit. J&J filed a lawsuit against Save on SP about 2 years ago. But you know what? The numbers don't lie. If it's something doesn't seem right, it's not right. There's something that's not true. If somebody is telling you a lie, it doesn't make sense. And if it doesn't make sense, there's something that's not true. They are, and the manufacturers, so your drug company manufacturers, they have gotten wise to this interloper here, and they've written into the CPAP, which is the patient assistance programs, if you have insurance and you have an accumulator, you can't get
and if you're found using it, you're blacklisted. You can't ever use the copay accumulator or like the copay savings, whatever, again, because you've been found using it
inappropriately and fraudulently. Some of these interlopers take it up a notch, and they will sell the manufacturer's $20,000 copay assistance back to the employer for a percentage of list price. Well, nobody pays list price. So you might take a drug that's $3,000 every 8 weeks, and it will be sold back to the employer for a big savings of, you get this for only $6,000 a month. Well, because the list price was $28,000, but the list price is the price nobody pays. So it's just like all of this non-transparent, opaque shell game with all these different revenue streams, all owned by the insurance companies that are just harming patients. Every middleman that sits in there is one more burden in between the patient and the doctor.
You had a TikTok the other day where you were on the phone with this company, with one of these accumulators, and they wouldn't tell you how they got the patient's phone number or how did they even get involved. So they're waiting, and you're saying, well, she doesn't want to, you said she doesn't want to talk to you because you exposed that if the woman did call based upon whatever the recording was, it would then create that relationship that they were trying to refute. How did it even start where this vulture company, this pariah, got involved to begin with? How did the patient or you even know about it?
I think it happened. So Ziggy, I had to give my dog away, and we've been like helping this patient, and she lost her insurance and then was messaging me, and she's like, I just picked an insurance plan. I'm paying $15 extra a month, and I signed up for an accumulator. I have it's not covering any of my medicine now. So then Julie and I were looking into it, and we're like,
how does it?
He was in the union, and we're looking, and she's like, I'm paying $15, and I was like, you're paying $15 for us to fill it out? And then we did more and more research, and then we realized we're like, what the heck is going on? And it got so bad to the point, SaveRx, I think they're in Philadelphia. There's the owner is Claudia Dunbar, and they were so thrown off by Julie and I calling them out that they met up afterwards and were trying to find something negative about our office. And this guy goes, I know you wrote a prescription the day Dr. Bach died. And Julie's like, I have 4 mid-levels, you Nimrod.
Here's the thing. There's nothing that's free. Pay your Medicare premiums, pay your Medicare supplemental premiums, union leadership, and let's just give the retirees choice, honesty, decent medical care, because that's what these workers signed up for 5 years ago, 10 years ago, 20 years ago, whatever years ago. This is a new game in town, and it is literally a revenue stream of a revenue stream for insurance companies to make more money off the backs of the retirees. They limit their choices. They limit their networks. They add in stuff that will make them functionally uninsured, and they're not here for it. They are not your friends.
Medicare Advantage is going to cost you so much more in the long run if you have a chronic illness. And I know Medicare Advantage, I see commercials for it all the time. It sounds so great, but if it sounds so great, why does everything need to be prior authorized, step therapy? Why do you need all these steps in order for it to be so great? It's not saving money.
Listen, no. I am 60 years old. My parents are 86 and 87. This is what I do for a living. And they still 3 years ago got my parents hooked up with United Healthcare, Medicare Disadvantage. And I said, Dad, what are you doing? I said, once you make this decision, you can never go back.
And he's like, I got a shoehorn.
He got a plastic shoehorn with the United Health Cartel logo on it. I said, Dad, that thing costs 2 cents. He goes, but I get to order.
Look at it.
I get to order Pampers for my mother, to the tune of $50 every quarter.
The debit card.
That's not anything. You traded in your future healthcare for a 10-cent shoehorn and a $20 pack of Pampers for mom.
Yes.
Once they make that decision to go there, they'll never make it back.
Let's explain that, because when we keep telling them, the unions will keep saying to us, but it's enhanced, it has benefits Medicare doesn't have. But what you literally do is, and they'll say it gives you vision, it gives you dental, it gives you hearing, it gives you a $50 debit card or a $200 debit card every month. But it's at a direct expense for the one thing that insurance plan was supposed to give you: direct access to doctors and hospitals around the country
to ensure you can get health care.
Yes.
I mean, it's such an important message, and the retirees are lucky to have an educated, articulate person like yourself advocating for them, because but for the work you're doing, all the retirees would have been sold out 4 years ago. But why? Why is Aetna coming all the time to you? Has Aetna ever called you and said, Marianne, we want to explain this to you? Have they ever asked you for a meeting?
No. And they
those that have nothing to hide nothing. Aetna, come on. Let's hear your side of the story. You tell these 3 old girls and let's have a meeting.
Young. Aetna told Julie, she goes, Aetna was like, get off TikTok. And Julie was like, Claudia, you have to go to this Aetna meeting with me or whatever, because they want to talk about our social media. And I'm like, I hate the room with Doom, but okay. And she's like, the end of the meeting, she's like, okay, you said you wanted to talk about something else. What? I have my social media person here. What do you want to talk about? And they're like, oh, nothing. Have a great day.
In the meantime, I've got emails from Aetna saying, get off TikTok. Now, why does Aetna want me get off TikTok? All they did was give me an advocacy slideshow from Aetna leadership saying, get off TikTok. Your TikTok videos are going all over Aetna.
We've seen, trust us, leadership has seen your TikTok videos.
Oh, I bet. I mean, my little rinky-dink practice in Bridgeton, Missouri is underneath the skin of multi-billion-dollar international company Aetna. We must be doing something right.
We get reported for bullying and harassment all the time. And I'm just like, I think these guys should have to stand in front of us and be like, you really hurt my feelings.
That happened to us too. We took a group of retirees. We did a national day of action, and we coordinated with like different like people's action groups and Connecticut groups. And we brought a group of retirees to Connecticut, and they went to the Aetna headquarters, and then we'd have the bus drop them off down the block to, I think it was United Healthcare. And we did a protest. Well, Aetna found out because they infiltrated my Facebook page. There's like 30,000 people on my Facebook page, which is our organization, New York City Organization of Public Service Retirees. But we kept it private because our group is private. I have a public page, but a private group, which is just meant for the retirees. Well, they infiltrated our page and then our private group, and they found out that we were doing this day of action, that we were coordinating with other retirees around the country to protest Aetna Medicare Advantage, or Medicare Advantage in general, because we were going to different insurers, depending what state you were in. Anyway, they set up security. They wouldn't allow us on their side of the street. They banned us to the opposite side of the street. We couldn't access their headquarters, and they were trying to keep us away from them. And we brought our own press because we figured that they would get blocked as well. But we put out press releases and that this is what we were doing. They still blocked it. And then they yelled and screamed at my lawyer that I need to be controlled. I'm like, I don't need to be controlled. I mean, this is America. I still have free speech, as do you. And that's the thing, is that they don't like us telling the truth. The vice president of Aetna, one of the vice presidents said, and I guess that's like a Cheerio. They give everybody a vice president title. And one of the vice presidents told our unions, and it was 100 unions in a room back when they were doing the request for proposal, the RFP for this plan, that we could see any doctor in America that accepts Medicare. Well,
wrong.
You can see any doctor in America that accepts Medicare if they accept your plan or if they accept it for payment, which many doctors and hospitals don't want to. They also told my retirees, and I have a subset of retirees that live in continuing care residential communities. You enter as independent, transition to assisted, nursing, or memory care. It's a lifestyle with dignity, especially my single seniors live there. They accept no HMOs, no MAs, because they have a medical director on staff that helps their residents transition through whatever stage of medical needs that they have. They make the decision. They can't have an HMO or an MA. So and how we found out about this was one of the residents asked us, hey, can you help me with this? And we said, yeah, sure. And they said, our director is saying that they don't accept Medicare Advantage. So now you're an elderly person. Typically, what this subset of population would need would be hospitalization, skilled nursing, and rehab. The highest three issues that they deny prior authorization for, that now puts the burden on the facility medical director to somehow take care of you. Well, while we're debating this back and forth with Aetna and this retiree and our organization, the VP is saying, no, it'll be fine. Don't you worry. Well, she goes into the dining hall. She meets a woman who was from Exxon. Now, this was our very first foray into learning that Exxon, a private company, auto-enrolled their retirees into Aetna Medicare Advantage. We just thought it was municipal retirees. Now we're learning it includes private retirees as well. The mom was in her 90s. The daughter was in the dining hall crying, and my retiree said to her, what's going on? And she said, well, my mother lives here. She's in her 90s. She's a retiree from Exxon. And they want to put her in, I think it was skilled nursing or rehab. And Aetna said no. And
of course Aetna said no.
Yeah. And so now she says, well, wait a second. I'm dealing with Aetna. They're telling me that they're working this out. This was the litmus. If they would approve it for this woman, then maybe she'd feel comfortable with what was being forced on us. That woman was denied. The Aetna basically told the daughter who lived in Texas, this was happening in Florida, you go take care of your mother. So she had to leave her family to go take care of her mom.
And then Aetna walks away with a pile of money. Like, if something sounds too good to be true, it is. This is nothing than just taking from the retirees and putting it in the insurance company's pocket. And they do it multiple ways. They do it through prior authorizations. They do it through referrals. They do it through narrow networks. They do it through accumulator programs. Get insurance companies out of healthcare. Understand that an insurance company and a pharmacy benefit manager are middlemen doing none of the actual healthcare work. Those are direct patient care dollars that are earmarked for patients and doctors and pharmacists that are doing the work that are all being siphoned away.
Doctors make 5% of your total medical spend.
Where does the other 95% go? Could it be it goes to Aetna, United Health Cartel, Cigna, Anthem, and Humana? Perhaps.
Tell me what you go through on trying to get a prior authorization approved and how long it takes you, because I see you on TikTok and I'm sure it probably went through a few phone calls before you got to that point where you're like, well, I'm just going to take this to the airwaves and let social media dictate what happens to you because you didn't do the right thing.
If it gets to us, it's been exhausted.
Yeah. I mean, I have 24 staff. So if a case comes across our desk, that means all the normal channels have been followed. Okay. And the denials and the delays are just stacked up. Two things happen with delays and denials. Like even just something like a injection, a visco supplement knee injection, you get a series of 3 of those. Aetna and United Healthcare, and they all have different preferences of drugs. So we use Euflexa for visco supplements primarily, but apparently every quarter, the insurance companies they get different rebates on different drugs. So they might come out and say, oh, you know what? This quarter we're doing Monovisc. What? But we lose money on Monovisc.
And
we can't afford to inject it. The acquisition cost, what I pay for Monovisc, is higher than what you reimburse me. If I'm not paying attention, I'm going to have my doors closed. So why would an insurance company and a pharmacy benefit manager want to switch up drugs potentially every quarter? The money. Why would an insurance company and a pharmacy benefit manager need to direct me, a physician's office, on what drugs I can use? The money. Right. It is just a delay and denial tactic. That's all it is. And one of the really sad things for a rheumatology patient is when we get them stable on drug, we don't switch them for NMS, non-medical switch. Non-medical switches are nothing more than in each insurance company's preference on how they make more money. In 2020, we made 2 non-medical switches. Both the patients were stable on an infusion drug called Remicade. The first thing I do when we get a case is we call the patient and say, you going to advocate with us and stand shoulder to shoulder with us? Or do you want to just do what your insurance company wants? I had 2 patients that said, okay, well, let's just do what our insurance company wants. Both of those patients were infused with the insurance company's preferred drug. Both of them had such severe reactions that they'd be transported to 911 to the hospital. And one of the patients, it took 18 months before we found another drug, because when they fail a drug and they try to go back to the originator, it doesn't work. So I'll be damned if we're going to take somebody and do a non-medical switch. By the time you get these chronic patients stable, we don't jack them around and yank them around so the insurance companies can make more money. That was the last time I did that. We don't give patients a choice. If they want to do what their insurance company wants, they're going to have to work with their insurance company. If they want us to advocate for them for access to care, then they better shoulder up with us, because it's a showdown. It's a fight. Now, all that being said, I have been very successful in getting direct contracts with employers to bypass the pharmacy benefit managers. Boeing doesn't mandate me to use a pharmacy benefit manager for infusion drug. Edward Jones doesn't make me do that. The companies are actually saving money by not using the pharmacy benefit managers. They just don't know it. because the people making the decision is typically the CFO, Chief Financial Officer. The Chief Financial Officer is typically more concerned about the bottom line of the company and not as focused on and educated on what the health plan is doing. The health plan is out of control. And they are just like, oh my God, just like, let this broker take care of it. Well, a lot of times the brokers are making $5 on a prescription for every single person. There's compromised brokers and there's real brokers. Like in St. Louis, in Missouri, the insurance brokers are getting $601 in commission for every poor soul they sign up for Medicare Disadvantage.
Right.
And they only get like $40 to sign somebody up for traditional Medicare and a supplement. Where do you think they're signing people up?
I did a video on this.
Yes, it's just a shell game. And I don't fault brokers because everybody needs to make their own living. But by God, that's my own parents miss anti-Medicare Disadvantage. And my parents signed up for Medicare Disadvantage because they got a shoehorn. Like, it's just, it's criminal. It's criminal.
Yep, I get that. I will still have a few retirees. There's one retiree I spoke to the other day in Delaware and another one that I spoke to in Florida that thinks I'm wrong. Mm-hmm. And I'm like, no. The issue is you just haven't found this to be true for you yet. But it's not a matter of if, it's a matter of when this is going to impact you. Right now, you're thinking it's okay that you got that shoehorn or the gift card or the free gym pass or whatever, crapola that they gave you, but you're not using your insurance for the exact thing that you were meant to. One gentleman said, well, I had cancer and they treated it fine and I never had a problem. Then I have another person who advocated for the plan. And then literally just before this other gentleman died, was ready to come out against being forced into this plan, that it was fine to be an option because it worked for some people until it didn't, but which was Medicare Advantage was initially founded as an option alternative. But what they don't tell you in the small print is, like you were mentioning, once you're in that plan for 12 months, if you don't get out of it within that 12-month trial period, and you're not in one of 4 states with a guarantee issue right, Maine, Massachusetts, New York, and Connecticut, you may never be able to get back into traditional Medicare with a supplement. You'll always have traditional Medicare, but then if you can't get that supplement, that 20% you're on the hook for.
And you'll go broke.
Yes, and that came out during the course of our litigation against the city of New York. What we learned was, and through having experts help us with this, is that if you're outside of those 4 guarantee issue states, let's say you're on that plan for 16 months, and then you said, oh, this isn't working for me, they're denying everything, or there's no doctors in my area, I have to drive an hour. Then you decide to go back on traditional Medicare. You're now subject to underwriting, which you wouldn't have been before. Now you're older, you probably have a complication, and through underwriting, they're going to go, ugh, Marianne was a World Trade Center responder. She's got all these health issues. She's got autoimmune troubles. She takes these monthly infusions. She's a higher risk to us. That Medicare supplemental plan that the city was originally paying $200 a month for, that's going to cost you $800.
They will price you out of the market. It is wrong. It is not fair. And you know what? I believe so strongly in this, but and patients having a choice of Medicare and not being forced into Medicare Disadvantage, give me a seat at the table, Aetna. Make it make sense to me. You explain it to me and let me explain it to you. And let's let the retirees draw their own damn conclusions. These are smart, educated people that have worked hard for this city based on the fact that they're going to be taken care of in their retirement. You pulled the rug out from underneath them. Give us a seat at the table.
So what would you tell to unions, young union leaders that are right now hearing management say to them, hey, this is a bargain. It's an enhanced. It's better than traditional Medicare. We'll give you a raise if you accept this.
If your employees are going to get very, very sick and not get treatment.
I mean, if somebody is willing to slide how much money across the table?
600. We had someone comment and say, I get paid $626 every Advantage plan. People want to switch when the supplementary costs get too high.
Right. If Aetna is so interested in making the union membership whole and caring and providing care, why do they need to give the leadership in the organization a bribe? What's that for?
Yep.
If it's such an advantage, why wouldn't we just accept this with no bribe? They're essentially giving you a bribe, are they not?
Yeah, and what it was the cost of our plan. So if there's approximately 250,000 New York City retirees, our supplemental plan cost roughly about $200 a month. Times 12 months was the 600 million. So they were literally giving them the value of our Medicare supplement back to the union's welfare funds, which they were using this fund. They were sticking this money in a fund that was literally financing their raises. And they said to them, look, if you do this, we'll put this money in this fund, knowing that that fund had been misused at sometimes, not just by the unions, but also by the mayor to fill budget gaps and whatever. But the fund is what they were using as a cash cow. They wanted another way of a cash infusion. And by selling off retired workers who were no longer in their unions, by privatizing their Medicare and sticking them on this MA plan that both management and the insurer were telling them is enhanced, it's better. And where all of us that are of that generation or in a Medicare plan, whether we're of age or we're on disability, we're 9/11 responders, we're disabled New York City employees, we're line of duty widows and widowers, those that lost their spouses in the line of duty. We have seniors who have adult disabled children. So they're in their 70s, 80s with an adult disabled child. These are all people who are on Medicare. But we didn't have a seat at the table and we didn't have a seat at the room. And when we tried to we did a rally in New York City a week ago. And we literally brought a Shirley Chisholm poster with us that said, if they don't give you a seat at the table, bring a folding chair. And that was her saying. So we all brought little collapsible stools and we occupied our union hall because they were trying to have a conversation and not pass legislation. Our bill is Intro 1096 that would protect our traditional Medicare, that they can't force us into MA. And they didn't want to hear that conversation. And where I'm getting calls from union leaders around the country saying, what is this? My retirees are sending me your videos. Who are you? And what is this about? It's because they don't know. And they're just being told Medicare Advantage is better. It's enhanced and it has benefits that Medicare doesn't have. While it has, if you want to take the literal sense of the words, benefits that Medicare doesn't have, well, you're not even really getting a comprehensive vision or dental plan in there, but it's at the direct expense of your healthcare. When you purchase house insurance, home insurance, renter's insurance, or car insurance, it doesn't come with other perks. Like you don't get a pair of sneakers with your car insurance. If I did, I'd probably think, geez, my insurance company going to be there or they want me to walk, Right.
Well, listen, if you don't have a seat at the table, you're on the damn menu. Okay.
That's it. Amen,
and
sister.
they are screwing the retirees, and they're going to tell the decision makers whatever in the hell they need to tell them to get this contract, because it's a one-way ticket to hell. Yeah, and once they get this done, your people are screwed. So I am happy to come up there and stand shoulder to shoulder with you, my friend. I would love to show up there and ask some questions right next to you. And I do my best work in a church basement folding chair.
She promises me a trip to New York too.
Yeah.
Okay. That's a deal. I keep saying, let's wait till it gets a little warmer. We just did a rally to City Hall the other day. It was 29 degrees. We brought about 30 retirees into a district. We took the subway into Councilman Eric Botcher's district, which is in like Chelsea area, lower Manhattan. And then we walked around his entire district. There wasn't too many people on the street, but when we walked into senior centers, that was owned by the city, by the way, they wanted to kick us out and shut us up. So we made some noise, but I will tell you, 29 degrees is pretty cold, but not as cold as it is where you guys are.
That's all right. We have mittens, hats, and coats, and a pitchfork, and we will travel because every one of us is a patient, and every one of us has been denied or delayed by our insurance company. I feel super strongly about patients need a choice of Medicare and a supplement versus auto-enrolled into Medicare Disadvantage. It's the wrong thing. And when you do the wrong thing, you need to be held accountable for it. I mean, I'm all fine and good with having 30-year-olds make decisions, but you know what? Get educated on it and talk to the people, okay? Because one of these days, you're going to be 65 and you're going to be like, holy crap, what did I just do to my poor colleagues?
Oh, no, all we have is Medicare Advantage now.
Right.
I know.
So, yeah, you're doing the right thing. Ask the questions. I would love to have a conversation with the union leadership making the decisions, or anyone that wants to talk about this, because we're all being harmed at the expense of the taxpayers. That's all.
Why don't you tell people how they can follow you? Because your advocacy is pretty amazing. And I'm glad we connected with you last year. Even Wendell Potter came out to visit you guys, and that video was pretty awesome. So tell our viewers how they can follow you on social media.
Claudia?
Our TikTok, since it's not banned, is C_money636. And then we have YouTube, which is Don't Back Down, DONTBAAKDOWN. And then Julie's TikTok or Twitter, is Arthritis Center STL. But if you just search Don't Back Down or C_money636, our SEO is great. We show up all over the place.
Well, and let me tell you, we pivoted to her personal social media account on TikTok from her 8th grade, which is C_money636, because Cigna sent us a cease and desist letter. Now, again, if you're having to silence a little rinky-dink office like mine, you're doing the wrong thing. But in 18 months, she went from 100 followers on TikTok to 57,000. So I maintain we must be doing something right.
You definitely are.
I mean,
now hold on. I just put in the chat. Did that come up somewhere? Let me scroll back down. Yeah. So, perfect. You guys, yay, you did it.
Yeah.
All right. I didn't know. I never really did an interaction here where other people, because I'm so glad you guys typed that in. I didn't know you could do that. So put your handles. You have, I just put in Claudia, C_money on 636 on TikTok. Put all of your handles on there.
Twitter, Arthritis Center STL.
Yeah. Everyone follow them, because their TikToks are really important. It exposes all the things that the New York City retirees have been fighting. You need to share these with your active unions, your union leaders, your former unions, the leaders that are making these decisions, since we don't have a seat at the table. Pass them to everyone, because we want to get more doctors to come on and do this with us so that they can share the struggles that they're having. Medicare Advantage is not Medicare, and it is not an advantage. And if you have to go through 5 levels of appeals in order to get something approved, that is not healthcare. And it's also a delay that can harm you, as the judge found in our case and in other cases, or even cost you your life. So, and it's really good to know that the insurance companies are sending you cease and desist letters or trying to shush you up. That means you're having an impact.
TikTok is not closed down. It's working, luckily.
Yes, it is working, luckily. You know what? At the end of the day, we're all just trying to do the best we can with what we have to work with. But we have people like Eric Adams, who is nothing but a charlatan, saying one thing and then doing another. And these people, if you're doing the wrong thing, then
see something, say something.
Yeah, like you can't do this to people. Every one of us is a patient. Every one of us has been denied and delayed by our insurance company. Why would we ever put our colleagues, our friends, our coworkers in harm's way medically? And I can tell you from this little doctor's office, doctors don't like Medicare Disadvantage. Patients don't like Medicare Disadvantage. So why in the hell would the New York retirees like Medicare Disadvantage?
They wouldn't.
They won't. And I love the work you're doing, and I'm happy we're happy to come on.
We could do it monthly,
weekly, monthly, bi-monthly. And we have a pitchfork. We'd love nothing more to fly up there. And
I've got a big
take it to the streets.
So do I. We make a good team. What I want you to do is highlight like one of your most egregious issues that you've TikToked, and let's highlight that like on a monthly video where we can share that all over the place to show what's happening for the most exposure. So start thinking of those.
I think that the video overturned that 6-minute video the mini documentary. That was
Oh my gosh, that was powerful.
Super powerful. That's the thing that I would like you to ask your retirees to send out, because that is the ultimate in delays and denials. And that was done by Claimable, which is a company that does patient appeals. Because understand, I'm just one doctor's office. We're just one doctor's office. We happen to be on the extreme side of we appeal everything, but only like 1% of doctors appeal things because they don't have the time. We appeal everything, but 0.2% of patients appeal something. So that's kind of another angle that people can fight. But you know what? You've already done the firefighting. You've already done the ambulance fighting. You've already served your country. Why in the hell do you need to serve yourself and fight with Aetna? Nobody needs to put on boxing gloves at the age of 65. Forget it. Let me enjoy. So
do you want me to close with that video?
I would love that. I would love that.
Let me see if I pull that up and then do a share screen on that. And then we can come back and say goodbye.
Put Blue Sky. Okay. Yeah. Because we're on Blue Sky too.
We're on Reddit, Tumblr, Pinterest, any social media you can think of, we're on there. Share screen.
The video, it's while you're looking at that, it is so moving, and it is one office's way through denials and delays. And my late husband, the great late Dr. Stephen Bach, we lost him August 21st of 2024 from brain cancer, and just rocked our world. But the one thing he said to me is find and keep a place for my patients. And so this widow, I was with him 36 years. He's only been gone actually 5 months today.
Oh, wow.
5 months today.
You make me cry.
I believe in this because everybody's a patient. So I have a voice, and by God, I'm going to use it. So if you can find that video,
this is a sign, Julie.
5 months today.
It's a sign. I'm sorry. I believe in signs.
Yeah.
And she's not backing down. She's not backing down. She's fighting.
Don't back down. Don't back down. Don't back down. Don't. Let's bring up your video.
Okay.
Now I got to figure out how to make it bigger. There you go.
Look at her.
And there's Claudia.
Hold on. Whoops.
I'm getting myself a little misty over that whole thing. You know?
I know. You made me all teary. Oh, wait. I lost it. Hold on.
This is a 6-minute mini documentary that was produced by some really amazing people. Ash Gilbertson in New York City. Super fangirl over him.
He's the coolest.
He came down to St. Louis and shot a bunch of footage. Wars Bakari from Claimable.
Here it is.
And here we go.
Get her on this phone call. I mean,
get the volume up, Marianne.
But we're speaking with you. That you don't tell them to call the
Hear it?
physician's office. It
Yes.
has nothing to do with this. You guys are like, you're doing the wrong thing. My name is Julie. I'm the practice manager and the bathroom monitor. And if you, my title,
We're getting, I would say, close to 50 denials a week.
yep, my last initial is B as in broomstick. And if you think Claudia had a bad attitude, you're going to love me.
We do what we can do, and then I pivot to public shaming on social media. We have 17,100 followers on TikTok. I have emails from Aetna saying, get off TikTok. Cigna sent us a cease and desist letter. How can this little tiny practice in Bridgeton, Missouri, get underneath the skin of multi-billion-dollar international company Cigna? We must be doing something right.
My body is in constant pain. Everything swells. I can barely sometimes walk, and my ankles hurt so bad.
I don't really think anybody that doesn't have it gets it. The popping and cracking of the bones every time you do something, the exhaustion, the brain fog.
I was literally on this sofa for 2.5 weeks. And when I say literally on this sofa, I could not get up.
My regular doctor sent me to the arthritis center. He said, you've got rheumatoid. After my first infusion, I woke up and I was like, oh, my back's not hurting. Oh my gosh. I think I finally found a medicine that's going to work for me. And from then on, I mean, I just started to feel better and better. And I got that letter. How do you deem something medically necessary for 3 treatments? And then you drop it.
We work extremely hard to care for patients that are really sick. The biggest barriers for me are straight up the insurance companies and their pharmacy benefit managers. These are interlopers that are standing in between the physician and the patients. They have no business making clinical decisions.
I'm a corrections officer, and several years ago, I began having pain. I was having a lot of trouble at work, trying to get through the day. When I came here, they were able to get me diagnosed and get me on a regimen. It was really a game changer. Then my employer decided it was time for them to explore changing insurance companies. And it was instantaneous that I went from having insurance that I was never questioned. It was just blatant, no, you're not going to get what's helped you.
It's difficult for me to take somebody who's doing well on anything and swap from one drug that's supposedly the same to another drug that's got a different name, and people don't do well. It's a really, really big problem.
We'll do whatever it takes to get the right drug for the right patients. We appeal absolutely everything. It's not uncommon for me to spend 100 hours trying to get a case overturned. And I don't think that most physicians' office have the bench strength and the tenacity to do that because it's hard.
I ran a couple of federally qualified healthcare centers. I am a healthcare administrator. Even for me to have a practice management background, to know the whole course of having to file an appeal, how to do it, right? You just get exhausted. So when Julie calls and said, hey, listen, we can help you do this appeal, I called my husband and said, you wouldn't believe what Julie did. I'm so excited. Let's get this moving.
Around 2.5 weeks after the letter was sent, somebody from the insurance said, we don't understand where the confusion is. We never said that you couldn't get your infusions. It was like, finally, something's going to go right.
The patient and the insurance company have a contractual relationship. That patient sends in an appeal. They have 72 hours to get back to them on an urgent appeal. And it's successful. It works.
How do you get to decide what's good for my life and what's good for my quality of life? My son-in-law is a Marine, and my oldest is getting ready to have another baby. I wasn't expecting grandbabies, and now I got a bunch of them. So I don't want to miss out on any of that because insurance doesn't want to okay my infusion, and it's just not fair.
Health insurance in the United States of America is the biggest scam in the history of the United States of America. That's got to change. It's got to change. So those are 3
You want to talk to
patients.
her?
Yeah, those are 3 patients from our clinic, and they're all doing great on therapy again. But because of actually Aetna in 2 of the 3 cases, those were cases that I couldn't overturn after 7 and 9 months of advocating. But the patient appeal pushed those cases over and got them overturned. So it's just, if you ask enough patients, you're going to find a common theme, and it's delay, denial, rinse and repeat. That's how it is.
It is. That's a very powerful video. That was a very, very powerful video. We're going to keep sharing that for you as well. It was wonderfully done, almost in the same, basically the same scale as like Be a Hero does, the Artie Barkin group that we aligned with Wendell and Social Security Works, Alex Lawson, and some of these other national organizations, PNHP. So I was very impressed with that, because it says everything that our retirees are going through, that we're forced into these plans, that they have to fight with. And it exposes what you have to do from the provider point of view, that there's, with us, it's 5 levels of appeals. Most of them are done on AI. Gloria Bent and Megan Bent lost her husband and father. Gary was a Connecticut state employee. He was a physics professor forced into United Healthcare and on MA, and he was denied rehab after brain surgery. So exposing what they had to go through, the AI, artificial intelligence, when I say AI, is artificial intelligence, for those that are unaware, makes these rapid fire decisions. And then you actually have to appeal them. They go through 5 different stages of appeals. And then sometimes you might win one, sometimes you get denied again. But most people out of frustration give up. But it shows the tenacity that you have, that if you keep on it, they say, I think Kaiser Family Foundation, 80% of denials are overturned. You just have to go through that very rigorous process. And it seems as if you have a war machine that's fired up to do that.
Well, unfortunately, we've been pushed to our backs against the wall, that the 2 of us do this full time. So it's really, really hard to win against someone who won't give up. We don't give up. But just trust and believe. John, the corrections officer in that video, you heard his voice crack. He had care with no questions asked. Minute he went to Aetna, boom, it was like a light switch. Every one of your retirees needs to watch that video, because that star on his uniform will mean nothing if they switch to Medicare Disadvantage.
Yeah, absolutely. Absolutely. I want to thank you guys for coming on with me today. And I know we said a half hour, but we're here an hour, and I absolutely love talking to the both of you. So
Amazing.
Let's do this. Let's keep doing this.
You have our number. Have Pitchfork. We'll travel. Fiddlesticks. Love you.
I love you guys too. Make sure you start flagging which one of I want to do once a month at least. Let's highlight one of your most egregious issues you've TikToked for that month. And let's blast this out there, because everyone needs to see what a provider goes through in the course of their day and what it puts their patients through. Guys, thank you so much. Again, Julie, my condolences on the loss of Dr. Bach. And I know that you are championing all of the things that he did for his patients as well, and Julie too, and keeping up this fight and working with us on this. And I think today was a sign. So
I think so too.
Yeah.
Love you. Have a good Martin Luther King Day.
Yay.
Bye-bye.
Have a great day. Ciao.
I don't know how to leave this.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way